So we're gonna go ahead and auscultate. We're gonna use our diaphragm. And we're gonna make sure that there's like no adventitious breath sounds, that they're all clear. And we're gonna listen in the same spot. So we're gonna start above the clavicle and work our way down. So when I place my stethoscope on your skin, I just want you to go ahead and take a deep breath each time, okay? Okay, good. I didn't hear any adventitious breath sounds. They were all clear. Since we're working on the front, I'm also going to do the heart sounds while we're at it. So with the heart sounds, we're going to start, we use the ape-to-man mnemonic. It's aortic on the right sternal border in the second intercostal space. If we go right over to the other side, on the left side, it's that left sternal border intercostal space, also known as the pulmonic heart sounds. If you go down one intercostal space to the third, so let's see, down to Ingo Louis, so 2. If we go down one intercostal space to the third, that's our Erb's point that we're gonna listen to. If we go down 2 more, which is right here, it's still on that left sternal border. That's that tricuspid valve that we're gonna listen to. And then if we slide over mid-clavicular, right underneath her boob is the mitral valve, which is that mid-clavicular line, 5th intercostal space. We're also going to listen to the apical pulse here. And then we're also gonna make sure that it coincides with the carotid arteries. So with this, we're gonna wanna listen with the bell, just to make sure that we can't hear any murmurs. And then you can just breathe normally, okay? Well, this little tag is gonna get in our way. Okay. And here we're going to also feel the carotid pulse up here. And for every beat that you hear, you should hear, or you should feel a pulse. You want to make sure that they're in sync. And they are. So I didn't hear any murmurs, which is good. The heart sounds were regular. They were at a normal rate, between 60 and 100.
Next, I'm going to be moving on to your cardiovascular assessment. So in order to do that, I'm just going to listen to your heart. And again, when I took her heart rate the first time, she had a normal rhythm. Nothing was wrong with that when I took her vitals. So if you could just take a deep breath in and out for me. First, I'm going to listen to your aortic. Good. And then your mitral. No. Excuse me. Your pulmonic. And your tricuspid, and lastly your mitral. I'm just gonna switch up your shirt. Very good. So her heart sounds are very clear, very normal, no murmurs. And now I'm just going to listen with the bell of my stethoscope, and just listen to the tricuspid and mitral valves. Perfect. So again, that was listening for S3 and S4, no murmurs.
And I'm going to go ahead and percuss at the apex, the base, the left sternal border, and I'm going to note that I didn't see a heave or feel a throw. And I'm going to go ahead and clean my stethoscope again. And I'm going to listen to the apical impulse in the 5th intercostal space, medial to the midclavicular line. And I'm going to listen for an entire minute, and I would hear 60 to 100 beats per minute, and I heard a short, gentle tap. Now I'm going to listen to the rest of your areas of your heart. So I'm going to clean my stethoscope again, and I'm going to start at the aortic area in the 2nd intercostal space to the right. And then right across to the left in the 2nd intercostal space, the pulmonic. And in the 3rd intercostal space underneath on the left, Erb's point. And then in the 5th intercostal space, the tricuspid area to the left of the sternal border. And then the mitral area, 5th intercostal space, medial to the midclavicular line. And I'm going to go ahead and do that again with my bell. So aortic, pulmonic, Erb's point, tricuspid, and mitral. And I'm going to note that the rate and rhythm of the sounds were regular with no sinus arrhythmia and no pulse deficient. And I would note that S1 was heard louder at the apex and S2 was heard louder.
Okay, next I am going to check some heart sounds. Okay. So suprasternal notch to the angle of Louis. 1st intercostal, 2nd intercostal. This is the aortic. Scoot back, scoot back. S1, S2 noted, no murmurs, regular rate and rhythm. To go to the tricuspid, the pulmonic, sorry, pulmonic. S1, S2 noted. Regular rate and rhythm, no murmurs. Okay. Then I'm gonna go 2nd, 3rd, 4th. But that's gonna be down here. The tricuspid. S1, S2 noted, regular rate and rhythm. And I'm going over midclavicular line to the mitral valve. Okay. S1, S2 noted, regular rate and rhythm, no murmurs. So heart sounds.
So I'm going to touch it here. So clavicle, 1, 2, 3, 4, and I'm going to come up underneath here. Is that okay? 4 and 5. I'm going to pull up just a little bit here, right about mid-clavicular line. And I can feel her apical pulse, but I'm going to have you turn on your left. Yep, come on over. And sometimes I can feel it a little bit better here. Good. So her point of maximal impulse is at the, go ahead and lay back, is at the 5th intercostal space, mid-clavicular line. Now I'm also going to feel some other borders as well. So in the meantime, I'm noting that her ribs are not prominent and her breathing is normal. Come right through here. Appears to be a normal rate and rhythm. No pulse, no pulsations, no thrills, no lifts. Good. I'm going to listen to you in this position and then I'll sit you up and lean you forward to listen as well. Okay? Starting diaphragm, I'm listed the pulmonic. I can hear S1 and S2. S1 and S2. Coming down to Erb's point. S1 and S2, moving down to tricuspid. S1 and S2, and down to the mitral. S1 and S2. No extra sounds, no S2, I'm sorry, no S3, no S4, no rubs. And I'm going to turn and listen for murmurs, starting with pulmonic. Aortic. Erb's point. Good. Tricuspid. Good. And mitral. A little higher. Sorry about that. No murmurs noted. Kathleen, I'm going to sit you up. Also, while she was laying back, I could tell there was no JVD, no distension. And I'm going to listen one more time in this position here. Pulmonic and Erb's point. And tricuspid. And last one here, I'll be able to lean forward just a little bit. Good, and stay right there. Listen for murmurs here. And Erb's point. Good, last time here. And no murmurs, no extra heart sounds, no S3, no S4, no rub.
Feel and for heaves or thrills, okay? So basically what I'm gonna do is feel different, these 5 precordial areas of your chest, okay?
Okay.
So the only thing you have to do is just breathe normal. I'm gonna go ahead and explain where I'm gonna be touching. We're gonna do the aortic area, which is the second intercostal space, right sternal border, the pulmonic, which is the second intercostal space, left sternal border, Erb's point, which is the third intercostal space at left sternal border, the tricuspid, which is the fourth intercostal space, left sternal border, and then finally the mitral area, which is the fifth intercostal space, left mid-clavicular line. This is also the apex area of the heart and also the pulse of maximum impulse, okay? All right, or pulse of maximum intensity. All right, so let me know if you have any pain here, okay? And again, I'm gonna go ahead and feel for your PMI. I'm also gonna do it while you're laying down because it's a lot easier when you're laying on your left side. All right, so I feel no heaves, no lifts. And from here, what we're gonna do is I'm gonna oscillate with the bell of the stethoscope and the diaphragm of the stethoscope in those same 5 areas, okay? I'm gonna get you to set up. You can lean slightly forward. Just makes it a little bit easier to hear the sounds. And what I'm gonna be listening for is the lub dub, the S1, S2. S1 is usually heard better under here at the tricuspid and the mitral valve, while the S2 is better heard up here. And then Erb's point, you kind of hear it all in that area, okay? And what I'm gonna be listening for is just normal heart sounds. All right, now I'm gonna switch to the bell. And the diaphragm, we hear the harsh, the louder abnormal heart sounds, and the bell, we hear the softer ones. So that's what I'm listening for here. All right, so you have good normal S1, S2. There's no extra heart sounds, meaning there's no S3, S4. And usually S3 and S4 is better when you're laying down. So we are going to lay you down for that as well, which we'll do in just a second. Here we're listening more for the aortic or the pulmonic murmurs, which is like aortic pulmonic stenosis, aortic pulmonic regurgitation, or these abnormal heart sounds that we normally hear if you have a problem with your heart. But yours are clear, so you don't have any of that, okay? And I didn't hear any other clicks or snaps as well, which is good. Those are kind of hard to hear. Again, some of this stuff is easier once we lay you down, which I'm gonna have you do now, okay? Move your stuff out of the way. All right, so at this time, I am gonna listen to the 5 precordial areas again, starting with the diaphragm of my stethoscope. And again, I'm going to be listening for 60 seconds in each area to make sure we hear the full systolic and diastolic movement of the heart. This area is better to hear mitral valve and tricuspid valve murmurs, such as the tricuspid insufficiency, mitral valve regurgitation, or tricuspid regurgitation. What I'm also going to get you to do is, if you can, is roll that way to the left side. And again, I'm going to listen with the diaphragm. And then I'm listening with the bell. that right. You can go ahead and lay on your back. All right, so again, no normal S1, S2, no extra heart sounds noted, no S3, no S4, no heart murmurs, no